The single highest one-day spike of over 40,000 new Wuhan virus cases across the country. The total case tally is now over 11 lakh. Now, there are currently more than 3,90,000 active cases in India. 681 deaths have been registered in the last 24 hours, a cause for concern because it was actually slipping into the 400 per day mark, and now it's gone up again and touching nearly about 700 deaths. 27,000 people overall have died because of the Wuhan virus. More than 7 lakh people have recovered, which is very, very encouraging. But the actual aspect is the recovery rate, which was 63.3%, is now down to about 62.6%, a cause for concern for all of us collectively. India's fatality rate much lower than the global average, but we have to keep that in check, and for that, all of us need to remember that we have to continue to keep the fight on. We cannot drop our guard. See, there you go. 17th of July, it was 63.3%. 20th of July, it's 62.6%. Now, the other reasons why we need to keep our chin up and believe that we continue to fight is the fact that there have been recoveries. 22,664 recoveries in the last 24 hours. Yes, 17,000 active cases, but 22,000 recoveries. So the recoveries continue to be more than the total number of active cases. Over 7 lakh recoveries overall. India's deaths per million now is at 20. The world average is 78. So we're doing well. 29 states with fatality rate less than the national average. 14 states with fatality rate less than 1%. India's tests per million population has also crossed the 10,000 mark. 2,56,039 tests were conducted on Sunday, which is a high number for a weekend on a Sunday where the total number of tests usually drops a bit compared to the usual weekly average. Total tests is 1.4 crore plus. And of course, we are in the hunt for the vaccine. We are working with world nations across the world, and perhaps India is quite ahead in the race because human trials for India's first indigenous COVID-19 vaccine, the Covaxin, has already begun at the AIIMS facility in the national capital. The indigenous vaccine has been developed by Hyderabad-based Bharat Biotech in collaboration with the Indian Council of Medical Research and the National Institute of Virology. Now, phase 1 of the vaccine trial will start, and it will be done on healthy people aged between 18 and 55 years who have no comorbidity. A total of 1,125 samples have been collected, of which 375 will be studied in the first phase. In the second phase, 750 people will be recruited between 12 to 65 years of age, and that's how the testing and the human trials will commence. Now, AIIMS Director Randeep Guleria has said that more than 1,800 volunteers have registered themselves for the trial, and a big salute to all these volunteers for what they have done. Listen into what Mr. Guleria had to say.
AIIMS has started now the phase 1 followed by phase 2 randomized double-blind multicentric study, which is for the vaccine for COVID-19. ये जो वैक्सीन कोविड-19 के भारत बायोटेक और ICMR की जो वैक्सीन डेवलप की है उसकी फ़ेज़ 1 स्टडी है। ये एक जो हम कहते हैं इनएक्टिवेटेड वायरस है, जो वायरस है उसको इनएक्टिवेट करके वो दिया जाता है बॉडी में, जिससे उसके रिएक्शन से इम्यूनिटी बने और फिर सब्सिक्वेंट इन्फेक्शन से प्रोटेक्शन हो जाए। एम्स के जो साइट है उसमें 1800 से ज़्यादा वॉलंटियर्स ने अपने आप को रजिस्टर करा दिया फॉर दिस ट्रायल।
Now, Sneha Murdani, tracking the Health Ministry, joining us live at this point. Sneha, Dr. Guleria is saying that 1,800 volunteers have come forth. We have accelerated the human trials. But India is perhaps among the leading nations to successfully devise a vaccine. But many experts also believe that this virus has multiple strains.
Yes. Yes, that's true. But will that have an effect on the vaccine in that sense? Dr. Guleria, the director of AIIMS, says no. And I'll tell you why he's saying no. He says no because he believes and he says that spike proteins are going to be used for vaccine development. And that is why a slight mutation of the virus, which has been seen in the country already, is not going to have much of an impact. He also has said that there is slight mutation, which is a fact. Now, Thursday or Friday is when, Anand, there's going to be the first human dosing of the vaccine. What does does that mean? That means the first time this vaccine is going to be injected, at least in this particular site where I am right now. I am at AIIMS Delhi, and this is one among the 12 sites where this vaccine is undergoing human trials. Phase 1 is going to take 2 months. Phase 2 is going to take 2 months again. So for both of these phases to complete, it's going to take 4 months in totality. There's been an overwhelming response, let me tell you that. I just had a word with Dr. Rai, who is in fact supervising the trials. He is a professor of community medicine at AIIMS, and he did tell me that the phones haven't stopped ringing. Essentially, when they did open up for human trials, a lot of people are coming forward right now. But, they have to factor in a couple of things. Pregnant women can't be taken. Now, if a woman is undergoing a trial, she has to, in fact, give a consent that she is not going to be ensuring that she doesn't get pregnant at least for the next 6 months, because this is a long drawn process. The side effects of the vaccine, of the inactivated vaccine, as we know it is Covaxin, is going to be studied for 6 long months. And this is something that's going to be continued to, over a period of time, essentially. Healthy volunteers, they are in the process of shortlisting volunteers, and I'm told that Thursday or Friday is when the first human dosing of this vaccine is going to happen. Good news, I'll tell you why again. India is known for vaccine development in terms of manufacturing. That's why anywhere the vaccine is made, it is going to be made, it's going to be, manufactured in India. But for R&D, no is the answer. We are not known in the world for R&D, but this is a landmark development where not just one but 2 indigenous vaccines are already in the process of entering human trial phase, and this is the most crucial phase, as we all know it, Anna.
True, and we have shown that we can escalate, or we can upgrade our R&D facilities, and also in times when we are pushed to it, through the times when we got our PPE kits right, we got our swabs for testing right, we got the testing kits right. So at all points in time, if we put our mind to it, we can get it right. In this case, let's hope that India is the one that leads the way, even in terms of finding a vaccine. Sneha, thanks for your inputs. We're going to take a very, very short break, and we turn the spotlight towards all the politics, and it's a very, very newsy day, politically heavy day, especially with what's happening in Rajasthan in that fight between Ashok Gehlot and Sachin Pilot. More on that when we come back. Stay with us.